What's up, everyone? Dr. JT here. I've got Dr. Alexa here as our patient. We are going to discuss cupping and how we can use them to help with Dr. Alexa's back pain that she's having, and kind of talk about what the pros and cons are with cups, why we use them, and so on. So the first thing we're going to do, what I've done, I kind of gained some access here to get to her lower back. And what we're going to do, I wipe down a little bit of lotion on here so that the cup will adhere to the skin a little bit better. We basically just take one of these cups. We're going to find some of the soft tissue where the muscles are, and then we'll just kind of get this loaded up and we'll pull on the skin. As you can see, the skin kind of lifts up and will turn a different color. So you've got a little bit of redness in here. The color is not so important to get. There is sort of a myth that the more red that the area is, the more damaged the area might be, or the more blood flow that's going into that area. Really, it's not so specific as to if there is more redness in one spot versus the other. That spot might be where the pain is or where the damage is. So don't focus so much on that. But essentially what we're going to do, we're just going to get a couple cups on here. Reasons why we would do this, there's kind of two working theories here. There is the Eastern medicine side of things and the Western side of medicine. The Eastern medicine side will focus more on trying to get more of like the lifting of the fascia, getting the blood flow to the area to flush out the toxins and just get fresh blood into the area to help create sort of this energy restoring path in the lower back. The Western side, which is more how I traditionally think with cupping, is really more about pain modulation. So if we think about lower back pain, a lot of times patients will come in, they're very acutely inflamed and irritated. So it hurts with doing a lot of these motions like bending, twisting, laying down. So what we can do when we put the cups on, there's sort of this takeaway of attention from the brain focusing on the pain. And now the brain is essentially focusing on the stimulation that the cup is providing on the skin. So with that, what we basically do, we'll just have the cups rest on the body in the area for roughly like anywhere from 3 to 8 minutes. And there's 3 other ways that we can kind of work with the cups here. So the way I've got this laid out now, this is what's called static on static. So the cups are sitting on Alexa and Alexa is not doing any movement. This is basically the first place that I would start off with this, just so the patient can get comfortable with this. If the patient has had cupping done before, you can then jump into other areas or other techniques rather, and do what's called a dynamic on static. So what I'm going to do is just kind of wiggle the cups. So now the dynamic part is the cup and Alexa's not moving, so she is static. And I'll just kind of wiggle back and forth here, just kind of getting more of that sensation for the brain, just confusing the brain into thinking that, we're focusing more on the stimulation from the cup rather than the pain that's actually occurring in the lower back. A lot of times with lower back pain, there tends to be this working idea that a lot of the pain comes from mechanical pain, so as if there's something structurally wrong. But what we're realizing more often than not is that it becomes a biochemical sensation to the brain or stimulus to the brain. So there is something going on in the back that is sending those pain signals to the brain. It may not necessarily be that it is the herniated disc or the arthritis that is what is causing that stimulus. It could be something different. So that's where this really comes into play and can actually help with modulating the pain and decreasing it. So those are the first 2 ways. The third way, I'm actually going to have Alexa move through this. So Alexa, can you get your hands propped up? And we're going to kind of get into a cat-cow position here. So she's going to come up into hands and knees position. We're going to hope that these cups stay in here. I don't know if I pulled them too much, but essentially what Alexa's going to do is now perform a cat-cow. So she's going to curl up. Yep. And now this is what's called static on dynamic. So the cups stay static, but now she is dynamically moving through. These are just 3 other ways that we can help to, again, create that stimulus to the brain of taking attention away. From the Eastern medicine side of things, this is also helping to flush out some of that blood and flush out some of that some of the toxins that might be built up in there. It can help just kind of decrease the pain overall. Sometimes you'll also get some short-term, thank you. Sometimes you also get some short-term range of motion adjustments from a positive standpoint. So because we've reduced some of the pain, patient might be able to move around a little bit better and just be in less pain overall. Okay, that's all I got for cupping. Again, the idea is 3 to 8 minutes or so just with the cups. and just letting the patient just kind of lower their pain so that they can move a little bit better. If this helped, like us, subscribe, and check out more of our lower back pain videos and other videos to come. Thank you.